Hip replacement surgery is one of my favorite surgical procedures. Prior to surgery, these patients are limited in some of the simple things in life, like putting on a sock, putting on a sneaker, or even sitting down to go to the bathroom. Following the procedure, patients can do things they never thought they'd be able to do again. A hip replacement surgery is the replacement of the ball and socket of your hip. If you look at this model, the clear parts are your bones. So the replacement of the hip is the replacement of the ball anchored into the center of your thigh bone. The replacement of the socket is the replacement of your socket by a titanium shell or socket. Inside that titanium shell is a plastic liner that's made from a very special hard plastic. The ball, often made of cobalt chrome or ceramic, moves freely inside that socket. Today's minimally invasive techniques are done through small incisions with minimal blood loss and very short surgical times. We don't remove a lot of tissue today. We open the hip up, we replace it, and we suture the tissue back up again. This will help prevent the hip from coming out of socket. And as you develop the very strong muscles around your hip, this will help you return to, again, activities you never thought that you could do. Following hip replacement surgery today, you will usually be up and walking within 2 to 3 hours. You'll walk as much as you can tolerate. You'll have incisional tenderness, but even some of the groin and leg pain can be gone the night of surgery. Some patients who have hip problems even complain of severe knee pain. This too may be gone the night of the procedure. Following the procedure, the typical stay is 2 to 3 days of simply walking and performing activities to strengthen your hip. 2 to 3 weeks later at home, patients are doing things they never thought they could do. They're riding bikes, they're even traveling, they may be driving, but they're doing things pain-free. I love hip replacement surgery.